the differences between South Africa and New Zealand and that. Talk us through that.
There's a really big difference in the funding streams. So when I say funding streams, it's essentially who pays for the service. Here in South Africa, you follow a private health insurance policy or process. So inevitably being in private practice, you're seeing patients that are all covered by health insurance, be it Discovery or GEMS or any of the multitude of options available. You weren't so much limited on what you could do for the patient. It was very much down to what their medical insurance could cover. So I would see a patient, and the decision about what I would do is based on what they can afford, or what the insurance can afford, or what they're happy to pay in as a co-payment, etc. Whereas New Zealand, it's very much government subsidised or government contracted. So we provide the service in New Zealand from a perspective of what's the best possible outcome that I can provide for a patient. And I won't say that there's no, money's there's no concerns around the money. There always is, because we have to follow within budget, but it just allows us as clinicians to be the best possible clinicians we can be and provide the best possible service and not have this financial burden hanging over us as a business or the patients as our patients. So it does have its pros and cons, because you're now not limited by what something costs and only being able to provide that. You actually have to step up as a clinician and figure out what's available, and it's very tempting to say what's the best brace or what's the best orthosis or prosthetic component out there. It's actually down to what's best for that patient. That's the most important thing, because I can sit there and tell a patient, this is the, throwing some New Zealand slang here, but this is the flashiest brace that we've got available.
Lit.
Yeah, but if it's like somebody's 80 or 90-year-old gran, they don't care. It has to work for them. It has to be the most beneficial to them in their lived experience, which is also an important part.
And you're not incentivized to do that by some, okay, that's very interesting. And then, so you basically get to help as many people as you possibly can.
Yeah.
Which is amazing. So, and then it's down to your time, energy, and attention.
Yeah.
And how to work, how do you do that?
So, I mean, I'm incredibly fortunate. So New Zealand as a country, you cannot study my profession in the country. They last provided it through tertiary education probably about 25 to 30 years ago, because it's a very niche field. So you can study it in Australia, and us as an organisation, we've started the process of supporting students to go and study, and then they come back and work for us. So there's a lot of expats that work for the organisation. So my office, I'm based in a small coastal, port city on the east coast of the North Island called Tauranga. There's 4 of us that are South African clinicians that work in my office. So it's great because there's that commonality between us as South Africans. Yeah. A lot of good conversations, and it's daunting, because it's quite different to be able to really step up and constantly make sure that you're staying not ahead of the curve, but you're just keeping up with the curve in a global profession, in a country that is often it's not teased, but it's just that you sometimes feel that you are on the far end of the world kind of thing.